You have a leadership team aligned. You have great ideas. You know where you want to go. You have a strategy. You have a vision. Okay, how are employees going to engage it? What are they going to feel in the day-to-day? And we're going to talk through a couple case studies, both really good, some short-term difficulties, some long-term difficulties that are having a ton of financial success, but what comes with that. And then also what we're seeing the space in general do to create a better employee experience.
And it goes back to, what's the goal of your organization? Typically, you want to enhance the program for your employees, and you want to save money or at least just make costs sustainable long term. To achieve those enhancements, you do need a little bit of an employee engagement to get there. Now, let's start from the top. When you're fully insured, what's the employee experience when you're working with one carrier, one network to manage your whole ecosystem? That card that an employee has to go access care after they pay their copays, their deductibles, their out-of-pocket maxes, it's really an open checkbook. They can go get any care they want. No one's checking for accuracy. No one's doing due diligence. And it is their credit card tied to your organization and your renewals.
Yeah. At worst, I'd say the most friction that employee is going to feel is going to be a pre-auth or prior auth process for a major surgery, which can be a good thing depending on how it's approached and if it's approached from a clinical perspective. And there are things that can be done before those things are received. But to Stephen's point, it's going to be relatively easy, but I think that's a relative term as well. As it's easy because it's what most people know. It's to date for the past 10 years, and if you look at a workforce over the last 10 years, the majority of them have been in a bundled, fully insured ecosystem or in a program that was controlled by one entity. That's just where we stand today.
And if you're looking to get those enhancements for your employees, as mentioned, a little bit of engagement must occur. And to get that engagement, you need to have an aligned leadership team on where you want to go. When you're fully insured and it's really a black box, you have one carrier, you have a card, there's no one helping your employee find the highest quality, lowest cost provider and give them a direct line of care to help them in their healthcare situation. That's an enhancement right there. The highest quality for them and their family at the lowest cost for them and their family. But again, to get there, it requires a bit of engagement from your employees. So, Brandon, I'd love if maybe you could talk about an example of what we mean here by engagement from employees.
Yeah, and we were sitting around, it was probably 6 months ago, and we typically have used the word friction. With more cost savings becomes more employee friction, but it's really not friction, it's required engagement. And what we've seen is when a group has engagement already built, it's easy to require just a little bit more. When a group goes from, hey, we don't ask anything of our employees to, boom, we want to take control of our healthcare plan. We want to start deploying some programming, some clinical strategies. There's noise. And I would say that's more of the friction camp. But required engagement, what does that look like? That looks like for an employee to have an enhanced experience, you may have to do something a little bit differently than you previously did. And I'm a frugal person. I'm all about required engagement. If I can get something for free or low cost, or someone says, hey, if you spend some amount of time, the value is there, I'm all in. But when it's something you're not used to or it's unexpected, that is where the noise can come from or the friction comes from.